Srimati Anupriya Patel ji. We have the presence of Dr. M. Srinivas, Member, Health Niti Ayog, Honorable Health Ministers from all the states and Union Territory, Union Health Secretary, Secretary Department of Health Research, Honorable Additional Chief Secretaries, Principal Secretaries, Secretaries from the state government for the Department of Health, all the senior officers from Ministry of Health and Family Welfare, and we have the presence, esteemed presence from some of the health tech private sector. We have Ms. Preeti Lobana, country head of Google India, Dr. Sangeeta Reddy, Joint MD Apollo Hospital and President of Nat Health. We have the representative from Association of Healthcare Providers of India and also from Consortium of Accredited Health Organizations. We also have the presence of the founders, co-founders and representatives from health tech startups, health insurance companies, and all the partners of digital health ecosystem who have joined today. Because of the lack of a space, they are in hall number 6 and will be seeing our whole event live from that hall. So today's event is extremely important in the journey of digital health ecosystem, where we have created the architecture for connected and integrated healthcare. And that idea has matured into a working ecosystem. As we all know, we have crossed creating more than 90 crores Abha ID in form of health ID for the citizens, and more than 100 crore health records are linked with Abha. In this journey, we have reached and achieved some of the milestones, and today it is a further addition to these milestones, and we will be launching a very important personal health record app, which will be the one-stop single application which connects for all the health services for the citizen in form of Arogya Setu. We all be knowing that Arogya Setu was used for contact tracing during the COVID time. That same application was handed over by Ministry of Electronics and IT to the Ministry of Health and Family Welfare for creating the connected digital health ecosystem. And that Arogya Setu already has a download of more than 20 crores, and now the new additions will be made after the launch today. We are also launching today a common lab code for India, the LOIN code for labs and all the lab-related informations. We are also launching today with the Bharat Health Terminology Service, which will become the common terminology in the field of healthcare. Similarly, today there is a launch of drug registry in form of the 4th pillar of Ayushman Bharat Digital Mission. Besides these launches, we have the dedication of 2 very important interoperability layers in form of Unified Health Interface and National Health Claim Exchange. These will provide further convenience to the citizen for a common layer to identify all healthcare providers and also for connecting the health claims between the healthcare provider and the payers. With these, we have few more applications which is related to Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. We are launching the upgraded Ayushman Bharat app, which will provide all the beneficiary of Ayushman Bharat regarding to get the information regarding their eligibility, their wallet balance. They will also be able to get their whole treatment history once they have got the treatment. With these, we are also launching one more application in form of Ayushman Sarthi, which is Ayushman basically WhatsApp chat bot, which is another service which will be providing to all the citizens. So with these, we have the presence of esteemed guests today, the leadership from both the center and the state. This is an occasion for all of us to be really privileged and honored to launch these initiatives in presence of you all. With this, I welcome everyone to this event. At the end, I also request we have put a small display of a health kiosk where each one of us can actually get our health checkup done, which is easily possible within minutes. We also have the provision for experiencing Arogya Setu app, besides experiencing also Ayushman Bharat app. With these words, I once again welcome everyone to this event. Now I request Honorable Union Health Secretary to give her remark on the occasion. Thank you.
Honorable Union Minister for Health and Family Welfare, our Honorable Union Ministers of State, Honorable Chief Ministers, Deputy CM, Health Ministers from states and UTs, Honorable Member Niti Ayog, Dr. Srinivas, Secretary Department of Health Research, senior officials from central and state governments, representatives of healthcare institutions and stakeholders from the digital ecosystem, all who are in this room with us and all who are connected through the video conferencing with us. A very, very warm welcome to today's very proud launch of digital initiatives. Dear friends, as you are aware, Indian healthcare system is undergoing a fundamental transformation, and we are not just digitizing the existing processes, but also building a healthcare system that is more connected, efficient, transparent, and responsive to the needs of every citizen. Over the last few years, the ministry has followed a very deliberate strategy of building strong digital foundations for healthcare. Rather than creating isolated technology solutions, we have focused on developing an interoperable digital public infrastructure that can connect citizens, healthcare providers, laboratories, insurers, and government programs through common standards and shared digital building blocks. The Ayushman Bharat Digital Mission has, of course, been central to this effort. And because of this mission, today you and I can get a continuum of health record if all the stakeholders participate in the system. So today's launches, I think, are not just a collection of individual products, but the next phase in the evolution and strengthening of our country's digital ecosystem. And I think today's initiatives reinforce a very important principle, which is digital transformation is not about just creating more application, but ensuring that every new digital capability is a part of the larger health ecosystem. And that's why, dear friends, we have all of you here, because we depend on you for ensuring that we are together an active participant of this digital healthcare ecosystem for the benefit of each and every citizen of the country. Health Ministry has had a very great track record, and thanks to all the states and UTs जो यहाँ पर हमारे साथ हैं, because of you all, the delivery of services in the country today is being powered by all these digital initiatives. So you recall on 30th April, you launched 3 digital initiatives. One was the Swasth Bharat platform, the portal, which ensures that जो हमारे healthcare providers हैं, उनको one data, once entry का support मिले, और हर citizen का profile, which is generated through 40 different portals, एक स्थान पर visible हो, available हो. इसके अलावा, sir, you launched the Janani platform as well as the Rashtriya Bal Swasthya Karyakram 2.0, where we are also integrating our databases with the database of Ministry of WCD as well as of Ministry of Education. UWIN has recorded more than 78 crore doses of vaccine. Nikshay portal is tracking each and every TB patient. The TB Mukt Bharat app is making life simpler for each TB patient. E-Sanjeevani has recorded over 48 crore teleconsultation. Telemanas has recorded nearly 39 lakh calls as well as over 2,000 video calls, a facility which Honorable Health Minister launched on World Mental Health Day. We have the Drugs and Vaccine Distribution Management System and the EVEN, which is supporting all the states and UTs here in tracking the logistics and the drug management system. We are even using digital technology for upgrading our health facilities, चाहे वो IPHS का toolkit हो या National Quality Assurance Standards का virtual assessment. So I think Health Ministry is powered by digital ecosystem, and I congratulate the National Health Authority, the state governments, and all our partners who today are helping take this forward towards a more connected, interoperable, and citizen-centric healthcare system. Thank you.
Thank you, ma'am. Thank you for your insight. Now we have the presence of Dr. M. Srinivas, Member Health Niti Ayog. I request him to give his remark.
Thank you, sir. Respected Shri Jagat Prakash Nadda ji, Honorable Union Minister for Health and Family Welfare, Chemicals and Fertilizers. Respected Shri Pratap Rao Jadhav ji, Honorable MOS, Health and Family Welfare and Ayush. Respected Srimati Anupriya Patel ji, Honorable MOS, Health and Family Welfare and Chemicals and Fertilizers. Respected Madam Punya Shalila ji, the Dr. Sunil Barnwal ji, Shri Madhukar Bhagat ji, Joint Secretary, distinguished the Chief Ministers, Deputy Chief Ministers, Health Ministers, Health Secretaries, senior officers of the states, esteemed members of the Council, colleagues, it's an honor to join you all on this launch of digital initiatives for the health sector. We are all carrying forward our COVID-19 pandemic success stories. COVID, we heard from Madam about all that. E-Sanjeevani platforms, and the launch of Ayushman Bharat digital missions in 2021 marked a new momentum of Digital India. It created core building blocks of Ayushman Bharat Health Account, Health Professional Registry, and the Health Facility Registry. We have heard many of those platforms with the Madam just now. ABDM is integrating the fragmented digital solutions. That was a big challenge for us into a national health ecosystem, which is designed to have large scale and a public good. This is something which is very important for all of us, and this will improve our efficiency in health services, for easy referrals, for reducing the duplications, reducing the paperwork, support of the clinical decision support making, and overall it strengthens our primary healthcare delivery in the country. Our digital health initiatives will enhance access. It will definitely enhance our equity and the continuum of the care which we heard about. And looking ahead, our ABDM has the opportunity to become a global model. We were just discussing with some of the council members that it is a model which is going to be not only useful for our country, but it is going to be a solution for the global south. So let us embrace all these digital initiatives and renew our shared commitment to the strengthening the health systems for a Viksit Bharat. Thank you very much. Jai Hind.
Thank you, sir. Thank you for your commitment and perspective on leveraging technology for connected healthcare. Now we have the esteemed presence of Honorable Union Minister of State, Srimati Anupriya Patel ji. May I request her for her remarks.
Honorable Union Health Minister and Minister for Chemicals and Fertilizers, Shri J.P. Nadda ji, Honorable MOS Health and MOS IC for Ayush, Shri Pratap Rao Jadhav ji, Honorable Chief Minister Tripura, Dr. Manik Saha ji, and Honorable Deputy Chief Minister from Uttar Pradesh, Shri Brajesh Pathak ji, Honorable Deputy Chief Minister, Madhya Pradesh, Shri Rajendra Shukla ji, Member Health Niti Ayog, Professor M. Srinivas ji, Honorable Members of Parliament, Secretary Health, Punya Salila Srivastav ji, Secretary DHR, Dr. Rajiv Behel ji, all the senior officers from central government and the state government who are present here, esteemed participants and every key stakeholder in the healthcare ecosystem who's part of today's very, very special occasion. I am very delighted to join you all today as we dedicate another set of digital initiatives to the nation. And these digital interventions, as we have heard, they are across three critical layers: standards, interoperability, and applications. Arogya Setu 2.0, this has been revamped into a comprehensive digital health companion for the citizens. And besides this, across the standards layer, we have the law codes, the Bharat Health Terminology Services, drug registry. Across the interoperability layer, we have the Unified Health Interface, the National Health Claims Exchange. And along the applications layer, we have the Ayushman app, Ayushman WhatsApp chatbot, the e-Sushrut Clinic, and the NHCX FHIR Insurance Plan Object Utility. Friends, healthcare at its heart is all about people. Hence, every policy we formulate and every digital intervention that we build, the ultimate aim is how it can make healthcare more accessible and convenient for the common man of India. And today, I would like to talk about, in particular, about the women citizens of this country and how they will benefit from the new digital interventions that we are launching today. When we build healthcare for women, we believe that we are actually building healthcare that will serve every family, the communities, and will eventually work for the nation. And in India, in most of the households, we've seen how women carry the silent responsibility of managing the health of the entire family. So whether it is keeping a record of a child's vaccination or accompanying elderly members of the family to the hospitals, managing their medicine schedules, women fulfill all responsibility and they keep their own health at the end. So these digital interventions today will actually help our women because they will bring everything at their fingertips, whether it is information or it is their entitlements or services. So women, especially I would say in the remote locations of our country, women who are living in the rural areas, for them, these interventions would be useful because they will not now have to travel along, carry those medical records in the form of bundles of papers from one facility to another. So a woman who's going to an Ayushman Arogya Mandir, her records are traveling with her. If she visits a district hospital, her records are with her. And if she needs to go to a medical college or a higher level facility, her records will travel with her. So that's how that ease of living for a woman is brought about by way of these digital interventions. And through initiatives like Arogya Setu 2.0 and the Ayushman app, she will be now able to securely access and also manage her entire family's health records, even understand the AI-generated health summaries, which will be available now in simple language, and access the government schemes much more easily. Besides a common woman, these initiatives will also help women who form the backbone of our healthcare system, ASHAs, ANMs, and the other frontline healthcare workers, because these better digital tools will now reduce their administrative burden. They will improve their follow-up with the beneficiaries, and they will also allow them to devote more time to patient care instead of maintaining the paper records. But then the most important thing is introducing technology alone is not enough. It has to be inclusive. So when we introduce these digital interventions, we have to ensure that these are easy to use for a first-time smartphone user. These are available in all the Indian languages. These are trusted, secure, and accessible, irrespective of geography, income, or location. Hence, it's important that digital literacy among women is also promoted and it becomes an integral part of our healthcare journey. I congratulate the National Health Authority today, the states, and all our partners on today's launches. Together, let us ensure that India's digital health journey leaves no one behind, and especially no woman behind, and becomes a powerful instrument of equity, empowerment, and inclusive development. Thank you all once again. Jai Hind.
Thank you. Thank you, ma'am, for your insight in use of digital initiative to empowering people and more particularly the women. Now we have the esteemed presence of Honorable Union Minister of State Independent Charge for Ayush and Minister of State for Health, Sri Pratap Rao Jadhav ji. May I request for his remarks on this occasion.
केंद्रीय स्वास्थ्य एवं परिवार कल्याण और रसायन व उर्वरक मंत्री आदरणीय श्री जगत प्रकाश नड्डा जी, मेरी साथी मंत्री श्रीमती अनुप्रिया पटेल जी, राज्यों से पधारे हमारे साथी मुख्यमंत्री एवं सभी उप मुख्यमंत्री जी एवं मंत्रीगण, डॉक्टर श्रीनिवास जी, सदस्य नीति आयोग, सचिव स्वास्थ्य एवं परिवार कल्याण मंत्रालय भारत सरकार, सचिव अनुसंधान विभाग भारत सरकार, मंत्रालय के सभी वरिष्ठ अधिकारीगण, राज्य सरकार के प्रतिनिधिगण, मीडिया प्रतिनिधिगण, स्वास्थ्य एवं आयुष क्षेत्र के सम्मानित सदस्यगण और हमारे सभी सहयोगी, आप सभी को मेरा नमस्कार। साथियों, भारत आज डिजिटल इनोवेशन में सबसे आगे खड़ा है और भारत के स्वास्थ्य सेवा सिस्टम को डिजिटल स्वास्थ्य सेवा में बदलने की दिशा में एक और निर्णायक कदम उठाते हुए इस कार्यक्रम में उपस्थित होना और आप सभी के साथ चर्चा करना मेरे लिए सौभाग्य की बात है। भारत सरकार का लक्ष्य है कि हर नागरिक को गुणवत्तापूर्ण और सस्ती स्वास्थ्य सेवाएं उपलब्ध कराई जाए। आयुष्मान भारत योजना, राष्ट्रीय डिजिटल हेल्थ मिशन और टेलीमेडिसिन जैसी पहलों के माध्यम से हम इस दिशा में निरंतर आगे बढ़ रहे हैं। ड्रोन सुविधा के माध्यम से दवाइयाँ और स्वास्थ्य सामग्री दूरस्थ गांवों तक पहुंचाई जा रही है। ऐसे सभी इनिशिएटिव डिजिटल इंडिया और हेल्थ फॉर ऑल के विजन को साकार कर रही है। हमने हेल्थ केयर को सिर्फ हेल्थ मिनिस्ट्री तक ही सीमित नहीं रखा है, बल्कि होल ऑफ द गवर्नमेंट अप्रोच पर बल दिया है। आज आयुष सहित सभी प्रकार की स्वास्थ्य सेवाएं देश के कोने कोने में आसानी से सुलभ हो रही है। जैसा कि हम सभी जानते हैं, भारत सरकार आदरणीय प्रधानमंत्री श्री नरेंद्र मोदी जी के कुशल नेतृत्व में आयुष चिकित्सा पद्धति को आधुनिक चिकित्सा के साथ एकीकृत करने के लिए काम कर रही है। भारत सरकार द्वारा राष्ट्रीय स्वास्थ्य नीति 2017 के अनुसार आयुष चिकित्सा प्रणालियों को मुख्य धारा में लाने पर विशेष जोर दिया जा रहा है। भारत की स्वास्थ्य परंपरा सदैव समग्र स्वास्थ्य की रही है। आयुर्वेद, योग, यूनानी, सिद्धा, सोवा रिक्पा और होम्योपैथी जैसी हमारी आयुष प्रणालियाँ केवल रोगों के उपचार तक सीमित नहीं है, बल्कि स्वस्थ जीवन शैली, रोगों की रोकथाम और दीर्घकालीन स्वास्थ्य संवर्धन पर बल देती है। आज जब भारत एक आधुनिक डिजिटल स्वास्थ्य परिस्थिति की तंत्र का निर्माण कर रहा है, तब हमारी पारंपरिक ज्ञान परंपरा और आधुनिक प्रौद्योगिकी का यह संगम एक नई दिशा प्रदान करता है। डिजिटल स्वास्थ्य का उद्देश्य केवल अस्पतालों का डिजिटलीकरण नहीं है। इसका वास्तविक उद्देश्य प्रत्येक नागरिक को अपने स्वास्थ्य के प्रति अधिक जागरूक, सक्षम और सशक्त बनाना है। आज प्रारंभ की जा रही डिजिटल पहल समन्वित स्वास्थ्य सेवा को भी नई गति देंगी। भविष्य का स्वास्थ्य तंत्र ऐसा होना चाहिए जिसमें नागरिकों को अलग अलग चिकित्सा प्रणालियों के बीच विभाजित न होना पड़े। यदि कोई व्यक्ति आयुर्वेद चिकित्सक, योग विशेषज्ञ अथवा आधुनिक चिकित्सा विशेषज्ञ से परामर्श लेता है, तो उसकी सहमति के आधार पर उपलब्ध डिजिटल स्वास्थ्य अभिलेख उपचार की निरंतरता सुनिश्चित करेंगे और बेहतर चिकित्सकीय निर्णयों में सहायता करेंगे। ये डिजिटल मंच आयुष सेवाओं की पहुंच को भी व्यापक बनाएंगे, नागरिक अपने स्वास्थ्य अभिलेखों का आजीवन सुरक्षित प्रबंध कर सकेंगे, स्वास्थ्य सेवाओं तक सरल पहुंच प्राप्त करेंगे और विभिन्न चिकित्सा प्रणालियों के बीच बेहतर समन्वय का लाभ उठा सकेंगे। सामान्य मानकों, संरचित स्वास्थ्य आंकड़ों और डिजिटल अभिलेखों के माध्यम से आयुष के क्षेत्र में अनुसंधान, नवाचार और साक्ष्य आधारित अध्ययन को भी नई गति मिलेगी। इससे भारत की पारंपरिक चिकित्सा प्रणालियों को वैश्विक स्तर पर और अधिक विश्वसनीयता एवं स्वीकार्यता प्राप्त होंगी। हमारा लक्ष्य केवल डिजिटल स्वास्थ्य प्रणाली का निर्माण नहीं है, बल्कि ऐसी डिजिटल रूप में सक्षम समग्र स्वास्थ्य व्यवस्था का निर्माण करना है जिसमें भारत की प्राचीन चिकित्सा परंपराएं और आधुनिक विज्ञान मिलकर प्रत्येक नागरिक के बेहतर स्वास्थ्य और कल्याण का मार्ग प्रशस्त करे। और अंत में मैं आज प्रारंभ की जा रही सभी पहलों के लिए स्वास्थ्य एवं परिवार कल्याण मंत्रालय, राष्ट्रीय स्वास्थ्य प्राधिकरण तथा सभी सहयोगी संस्थाओं को हार्दिक बधाई देता हूं। धन्यवाद।
Thank you, sir. Thank you for your insight. Now we have reached to the moment when we will be now launching the different digital initiatives. So now is the time we request Honorable Union Minister of Health and Family Welfare and Chemical and Fertilizer, Sri Jagat Prakash Nadda ji, to launch first application which is Arogya Setu. May I request for pressing the button and
What began as a pandemic response app during COVID-19 has evolved into a smart, all-in-one digital health companion for every citizen. Introducing Arogya Setu 2.0 in its new avatar. Built by the National Health Authority and powered by the Ayushman Bharat Digital Mission, it brings together digital health records, healthcare services, and wellness features. Managing and accessing personal health records is now simpler, smarter, and seamless with Arogya Setu 2.0. Citizens can securely upload and save their past medical reports on the app with DigiLocker and generate an AI-enabled smart health dashboard with health insights and long-term tracking of key health parameters. Families can easily manage medicines for the elderly by setting medical reminders and searching for nearby Jan Aushadhi Kendras to conveniently purchase affordable medicines. Fitness enthusiasts can connect smart wearables to track steps, sleep, workouts, heart rate, and daily wellness activities, making healthcare more connected and accessible for everyone. Benefit from quick OPD registration, share your health records, and make seamless payments to the facilities directly from app. Arogya Setu 2.0 also enables the search of nearby verified hospitals, diagnostic centers, and doctors, along with checking the availability of blood units in nearby blood banks and even book an ambulance in case of emergencies. And that's just the beginning. ABPMJ beneficiaries can now check the wallet balance and search nearby ABPMJ impaneled hospitals. Arogya Setu 2.0 is making healthcare more connected, intelligent, and bringing healthcare at fingertips of every citizen. Arogya Setu 2.0, Bharat ka health app. Download now.
thank you. Everyone can act. Yeah, I think everyone can download this Arogya Setu app, both from App Store as well as Google Play Store. Those who had Arogya Setu app from COVID times, they can actually just upgrade it. And today also they can experience themselves just outside the hall how it works. Actually, it is going to be one-stop shop for all health services in the citizen's hand. With this, I thank Honorable Minister, and we go for launch of the next digital set of digital initiative, which is the standard layers, and it's very important for connected healthcare. We have three digital initiatives in this. One is the Common Lab Code for India, As I said, for all diagnostic, it is going to be the standards. The second is the Bharat Health Terminology Services, which is going to be the common terminology, and it will be Indian terminology for all health-related informations. And third is the drug registry, which actually encompasses all the names which varies in different contexts are included and are mapped. So these three are developed by the National Health Resource Center for Electronic Health Records, Pune, and we request now Honorable Union Minister to press the button and launch 3 digital initiatives for a standard layer.
Every healthcare journey creates information, a laboratory report, a diagnosis, a prescription, a claim. But for this information to truly empower healthcare, it must be understood the same way through a common language that allows different healthcare systems to understand, exchange, and use information seamlessly. To strengthen the health sector, 3 important digital health assets are being launched. The Common Lab Codes for India, CLCI, brings a practical and implementer-friendly subset of international laboratory standards, LOINC, adapted for Indian healthcare needs. By enabling standardized representation of laboratory observations, CLCI will support seamless exchange of diagnostic information across the digital health ecosystem. Building further on this foundation, the Bharat Health Terminology Service will provide access to standardized healthcare terminologies, enabling semantic interoperability where systems do not just exchange data but understand the meaning of that data. This will support multiple use cases, including improving consistency in healthcare transactions and insurance claim ecosystems. Completing this foundation, the drug registry introduces standardized drug codification, enabling medicines to be represented uniformly across digital health applications, strengthening prescription dispensation and healthcare data exchange. Together, these initiatives create the common language of digital healthcare, where every piece of information connects, every stakeholder collaborates, and every citizen benefits from more seamless healthcare.
And these were the standard layer. As you could see, that the standards actually provides the seamless connected healthcare, because then we talk the same thing across all the health systems. Now we come to the next set of digital initiative, which is primarily relates to interoperability layer. Here we have 2 digital initiatives. One is Unified Health Interface, and it is actually to make just one face for the citizens by which they can actually connect to hospitals, pharmacy, diagnostics, blood banks, ambulance services. So this becomes the unified single interface for the citizens, similar to what we are experiencing as unified payment interface. So we have this as interoperability layer, and the second very important is the National Health Claim Exchange, which is actually to standardize all claims, which facilitates seamless and standard claim processing between health care providers, hospitals, and between the health insurance payers, which are the insurance companies. So we now request Honorable Union Minister to press the button and launch these 2 digital initiatives under interoperability.
Healthcare is a journey. It begins with finding the right healthcare service, continues through diagnosis and treatment, and often extends to insurance claims and follow-up care. For this journey to become seamless, different parts of the healthcare ecosystem need to be connected. This is where interoperability becomes the bridge. The Unified Health Interface, UHI, creates an open digital network where citizens can discover and access healthcare services easily. With UHI, citizens no longer need to navigate multiple applications to find essential health services. They can discover nearby healthcare touchpoints such as PMJ impaneled hospitals, Jan Aushadhi Kendras and blood banks through a unified digital experience. And as more services come on board, UHI will continue to expand, creating a more connected healthcare ecosystem for every citizen. The National Health Claims Exchange (NHCX) strengthens another important part of this journey by enabling seamless exchange of health insurance claims information between providers, insurers, and other stakeholders. For citizens, NHCX brings greater transparency to the insurance journey, helping them access information related to available insurance benefits such as PMJ wallet balance, track claim-related processes, and experience a smoother, more predictable healthcare financing journey. For healthcare providers, NHCX simplifies interactions with insurers by enabling standardized digital exchange of claims information, reducing manual processes, improving efficiency, and supporting faster claim processing. With this, all the three gateways of the Ayushman Bharat Digital Mission are now operationalized and dedicated to the nation for creating a robust digital health ecosystem.
Now we have the last layer, which is application layer, where actually citizens connect to the digital system. And here we have 4 applications. And first one is the Ayushman app, which we all know we had the PMJ app for the PMJ beneficiary. This has been upgraded to facilitate more features in form of wallet balance, treatment history, etc. Similar to that, we have launched the Ayushman Sarathi. We are launching that, which is a WhatsApp chatbot. We know many people are using WhatsApp, and they can actually query anything related to Ayushman Bharat PMJ scheme and get the information. The third very important is for the smaller clinic, CDAC has developed e-Susrut clinic application, which is a HMIS application for end-to-end digital services in smaller clinics. And the fourth is the insurance plan fire object creations. We all know that we take health insurance, but it is a long document. Here is the application which converts into the codes and understandable plan objects. So these 4 applications are very important in the digital health ecosystem. Now I request Honorable Union Minister to launch all these 4 applications.
The true impact of digital health is realized when technology reaches people. Today, a set of applications are being dedicated to the nation to make digital health an integral part of the healthcare journey. The Ayushman app brings PMJ services closer to citizens, making it easier to create Ayushman card, check past treatment details, and engage with more such services. Extending this access further, the Ayushman WhatsApp chatbot enables citizens to interact and receive assistance through simple conversations. For smaller healthcare providers, e-Sushrut Clinic, a web-based light HMIS, helps in creating interoperable digital records and facilitates consent-based access of longitudinal health records. It enables quick onboarding through ABDM registries like HPR and HFR. Equipped with powerful features like speech-to-text for e-prescription and CDSS for diabetes and hypertension developed by AIIMS Delhi, it empowers healthcare providers to deliver quality healthcare. Strengthening the insurance ecosystem, the NHCX FHIR Insurance Plan Object Utility will enable standardized representation and exchange of insurance plan information, supporting smoother interactions between payers, providers, and technology platforms. Together, these applications strengthen India's journey towards a connected, inclusive, and citizen-centric healthcare ecosystem.
Thank you, sir. Thank you for launching all these initiatives. Now, these digital initiatives for the health sector stand formally launched and dedicated to the nation. On this occasion, I must congratulate all the team members, partners, innovators, and the stakeholders whose efforts have made this happen today. And with these, we must mention India has been leading in creating digital public infrastructure in different fields, starting from Aadhaar and many more. In this respect, under the leadership of Honorable Union Minister, we have been creating digital public infrastructure in the form of Ayushman Bharat Digital Mission. We already today have launched the fourth pillar in form of the drug registry for Ayushman Bharat Digital Mission. And now with this, we request Honorable Union Minister to bless us with his keynote address on this occasion. Thank you.
आज के इस डिजिटल लॉन्च के अवसर पर हम सबके बीच में उपस्थित हमारे त्रिपुरा के मुख्यमंत्री सम्मानीय डॉक्टर मानिक साहा जी, हमारे मध्य प्रदेश के डिप्टी चीफ मिनिस्टर राजेंद्र शुक्ला जी, उत्तर प्रदेश के डिप्टी चीफ मिनिस्टर ब्रजेश पाठक जी, हमारे भारत सरकार में राज्य मंत्री स्वतंत्र प्रभार प्रताप राव जाधव जी, भारत सरकार में मंत्री और स्वास्थ्य को देख रही बहन अनुप्रिया पटेल जी, हमारे नीति आयोग के सदस्य डॉक्टर श्रीनिवास जी, हमारे सेक्रेटरी मिस पुण्य सलीला श्रीवास्तव जी, हमारे DHR के सेक्रेटरी श्री राजीव बहल जी, हमारे CEO नेशनल हेल्थ अथॉरिटी के श्री सुनील कुमार बर्नवाल जी, हमारे हेल्थ इंडस्ट्री के लीडर्स और हमारे डेवलपमेंट पार्टनर्स, सीनियर ऑफिशियल्स जो प्रदेश से आए हैं और हमारे सेंट्रल गवर्नमेंट से जो सीनियर ऑफिशियल्स हैं, प्रिंट मीडिया और इलेक्ट्रॉनिक मीडिया और फ्रेंड्स, ये सच में हम सब के लिए बहुत ही महत्वपूर्ण ओकेजन है आज, जब हमें इन डिजिटल इनिशिएटिव्स को लॉन्च करने का सौभाग्य मिला है और आप सब लोग ने इसमें शामिल हुए हैं। एक माइलस्टोन है, इम्पॉर्टेंट माइलस्टोन है जो आज हम लोगों ने उसको अचीव किया है और मुझे पूरा विश्वास है कि आगे ये निश्चित रूप से देश के स्वास्थ्य के दृष्टि से एक महत्वपूर्ण भूमिका अदा करेगा। हमने जो भारत की यात्रा है जिसमें हम हेल्दियर इंडिया और मोर डिजिटली एम्पावर्ड नेशन इसको मान करके चलते हैं, उसमें ये जो एप्लीकेशंस आज लॉन्च हुई हैं दैट इज़ गोइंग टू प्ले अ वेरी इम्पॉर्टेंट रोल। हम जानते हैं कि अंडर द विजनरी लीडरशिप ऑफ प्राइम मिनिस्टर श्री नरेंद्र मोदी जी in the last 12 years we have expanded the healthcare, and in the expansion of the healthcare many new initiatives have taken place in the past 12 years. If I talk about the National Health Authority and PM Jai, Pradhan Mantri Jan Arogya Yojana, it has brought a basic fundamental change as far as the healthcare is concerned throughout the length and the breadth of the country. We have in the past 12 years expanded the health facility and made it accessible and affordable for the contact of first point for the patient, that is patient-centric. And if we say so, I can say that we have consolidated the primary health care. At the same time, we have tried to develop a strong linkage between primary health care and the secondary health care. And another initiative which we have taken is that we have also seen to it that the tertiary health care is also strengthened. So it's a balanced approach which has been developed for the past 12 years that we have to understand. And in that, the digital initiatives, I can proudly say that now India is the world's largest digital public infrastructure healthcare. It's the world's largest. That we have to understand. I would like to share with you that when I talked about the Ayushman Bharat, and I said that PMJ program incorporates 62 crore people, that means 620 million?
Yes.
Am I correct? 620 million. In the World Health Assembly, people were aghast. They thought, they see the volume of it. And that is the world's largest health coverage program that we are having, that India is having. The same way in the digital mission, if I talk about, more than 90 crore Ayushman Bharat health accounts have been given. More than 100 crore digital health records, as Sunil Barnwal ji was talking about, records are there. Then if I talk about, we have now the hospitals are connected, the laboratories are connected, the healthcare professionals are connected, and this formulates the digital foundation, which is ultimately for the digital health ecosystem which we are developing, that we have to understand. Artificial intelligence is also a very important part, and in that also India has taken a lead. And when I say so, I would like to share with you that very recently, I don't remember the date, but say two months back, we launched the strategy for AI healthcare of India, that is SAHI. And the same way we launched the BODH, Benchmark Open Data Platform for Health AI. So these are the two applications which we have launched, and we are trying to see to that in the field of AI also, we as a leader can come forward. With the advent of the artificial intelligence, digitization is now no longer an option. It is a necessity, and it is a strategic necessity that we have to understand. So better we take in time, due course, we take initiative and steps to see to it that India in healthcare is digitized and we are going forward. As Sunil Barnwalji said, and my previous speakers have also talked about it, that the launches which has been taking place today, bringing these digital capabilities closer, and it is citizen-centric, and it includes the healthcare provider and also the facilities, the health facilities of every state, that is also incorporated. India's vision for future healthcare is, as I said, that the focal point is citizen and proactive rather than reactive, and we want that we should be connected. All facilities should come in one platform rather than to remain fragmented. And this is the effort we are having. Earlier, as we know, that healthcare was fragmented, but today all hospitals, government facilities, laboratories, pharmacies, and insurance companies, all are on one platform, and we are trying to see to it. And this helps for a common citizen to navigate. And previously what used to happen? We used to go from one facility to another facility with all the medical records, and time and again we had to, and we were repeating all those records time and again, multiple times that we are doing. But now with the launch of Arogya Setu 2.0, Bharat Ka Help app, which we say so, is comprehensive digital health companion, single platform citizen, all health records in one app, all access to the government health facilities, and receive the AI-powered health insights also, experience seamless digital healthcare. All this has been brought in this application. Now, if, for example, a lactating mother or a mother who has recently delivered, her son has to be vaccinated for 16 years and for 27 vaccinations for 12 preventable diseases. Now this is all electronic, digitally managed, and it is in this very application that we have to understand. So this is the difference, that the mother can track the vaccination program of his son or daughter timely. That can be done. The same way, a youngster who wants to keep an alert on his parameters of health, that can also be managed, and that can also be monitored. The same way, an old person having chronic problems, he can also get timely alerts about his health condition. So this is what this application is going to bring difference in our life, that we have to understand. The initiatives today launched, as I had said, is about the LOINC also, which is the Logical Observation Identifiers, Names and Codes. We'll bring all the terminology, Bharat Health Terminology Service, common digital language for healthcare. That is also going to bring a lot of difference. So there are many initiatives which has been explained in detail by the CEO, Sunil Barnawalji of National Health Authority. I would only request the states, and especially the health ministers and the health officials of the states, that we have to take the initiative and see that making or using digital platforms should be our priority. We should see to it, and not only the government facilities, but also the private facilities has to come on board. So that we have to see to it, and for that your personal initiative will be most welcome and will be needed. That is my request. And whatever we have achieved till date, it's all because of the involvement and their active participation of the states and the union territories. Health being a state subject, we can give you direction, we can help you in policy formulation, but the implementation is not with none other, it is with you all that you have to take initiative. So as you do good, India becomes healthier, India becomes strong, and as we are moving fast for Viksit Bharat, and we are taking a long leap, and we want to make India a developed nation by 2047, it will be only possible if we go together hand in hand and see to it that the goal is achieved. So your full cooperation is needed, your priority digitization will be needed, and if we want to become a developed India, we have to become digital India, that we have to understand. So for that, once again, I really congratulate the National Health Authority for doing a wonderful job, and the officials of the union government who have put in their effort to see to it that these launches takes place, and you all have come here and joined with us. I really thank you, and once again I congratulate all of you on this occasion. Thank you.
Thank you. Thank you, sir. I think your leadership reaffirms our collective commitment to harness technology for better health outcome, improved service delivery, and greater convenience for the citizens. With these, now we are coming to the end of this launch event. Now we request Sri Madhukar Bhagat ji, Joint Secretary E-Health, Ministry of Health and Family Welfare, to deliver the vote of thanks.
माननीय केंद्रीय स्वास्थ्य एवं परिवार कल्याण एवं रसायन मंत्री श्री जगत प्रकाश नड्डा जी, माननीय राज्य मंत्री श्री प्रताप राव यादव जी, माननीय राज्य मंत्री श्रीमती अनुप्रिया पटेल जी, माननीय मुख्यमंत्री त्रिपुरा श्री मानिक साह जी, विभिन्न राज्यों के मुख्यमंत्री, उप मुख्यमंत्री तथा मंत्रीगण, डॉक्टर श्रीनिवास, भारत सरकार के अन्य सचिवगण, आप सभी की गरिमामयी उपस्थिति, बहुमूल्य समय और मार्गदर्शन का मैं हार्दिक आभार व्यक्त करता हूँ। सचिव श्रीमती पुण्य सलीला श्रीवास्तव जी, जिनके कर्मठ नेतृत्व और दिशा निर्देश के तहत ये विभाग सतत अग्रसर है, उनका आभार। सीईओ एनएचए की संपूर्ण टीम, ई हेल्थ और मंत्रालय के अन्य कर्मचारीगण जिन्होंने इस कार्यक्रम को सफल बनाया, उनका अनेक धन्यवाद। विशेष धन्यवाद आरोग्य सेतु 2.0 की टीम का, NRCS सीडैक पुणे की टीम का एवं अन्य टीमों का जिन्होंने इन स्टैंडर्ड्स एप्लीकेशंस और पोर्टल की संरचना की, और आभार इंडस्ट्री के उन सदस्यों का जिन्होंने इस कार्य में अथक सहयोग किया। विभिन्न राज्यों से आए वरीय अधिकारीगण, आपका आभार। विशेष आभार मीडिया के सदस्यों का तथा इस आयोजन को सफल बनाने में सम्मिलित सभी अधिकारियों एवं व्यक्ति का मैं हार्दिक धन्यवाद देता हूं। ये प्रकल्प डिजिटल हेल्थ को ऊंचाइयों के तक ले जाने में साधक होंगे, ऐसे विश्वास के साथ आप सभी का एक बार फिर से धन्यवाद। अब आप सभी से अनुरोध है कि कृपया चाय के लिए ग्राउंड फ्लोर पर प्रस्थान करें।
आज के इस डिजिटल लॉन्च के अवसर पर हम सबके बीच में उपस्थित हमारे त्रिपुरा के मुख्यमंत्री सम्मानीय डॉक्टर मानिक साहा जी, हमारे मध्य प्रदेश के डिप्टी चीफ मिनिस्टर राजेंद्र शुक्ला जी, उत्तर प्रदेश के डिप्टी चीफ मिनिस्टर ब्रजेश पाठक जी, हमारे भारत सरकार में राज्य मंत्री स्वतंत्र प्रभार प्रताप राव जाधव जी, भारत सरकार में मंत्री और स्वास्थ्य को देख रही बहन अनुप्रिया पटेल जी, हमारे नीति आयोग के सदस्य डॉक्टर श्रीनिवास जी, हमारे सेक्रेटरी मिस पुण्य सलीला श्रीवास्तव जी, हमारे DHR के सेक्रेटरी श्री राजीव बहल जी, हमारे CEO नेशनल हेल्थ अथॉरिटी के श्री सुनील कुमार बर्नवाल जी, हमारे हेल्थ इंडस्ट्री के लीडर्स और हमारे डेवलपमेंट पार्टनर्स, सीनियर ऑफिशियल्स जो प्रदेश से आए हैं और हमारे सेंट्रल गवर्नमेंट से जो सीनियर ऑफिशियल्स हैं, प्रिंट मीडिया और इलेक्ट्रॉनिक मीडिया और फ्रेंड्स, ये सच में हम सब के लिए बहुत ही महत्वपूर्ण ओकेजन है आज, जब हमें इन डिजिटल इनिशिएटिव्स को लॉन्च करने का सौभाग्य मिला है और आप सब लोग ने इसमें शामिल हुए हैं। एक माइलस्टोन है, इम्पॉर्टेंट माइलस्टोन है जो आज हम लोगों ने उसको अचीव किया है, और मुझे पूरा विश्वास है कि आगे ये निश्चित रूप से देश के स्वास्थ्य के दृष्टि से एक महत्वपूर्ण भूमिका अदा करेगा। हमने जो भारत की यात्रा है जिसमें हम